Wonderful. Thank you, Dr. Waters. Thank you so much for the organization from your office, in particular, Brian Fenster. Thank you so much for organizing it. And thank you to all the participants and presenters. So we have a great program for you today. Next slide, Brian. So, we hear a lot of headlines about sort of the looming or present disaster of climate change and how it's impacting nearly every aspect of our lives. And these headlines can be overwhelming and the problem can seem huge. And I love this framing provided by Dr. Ed Maybach at George Mason University. He says climate change is just really simple. It's real, it's us, experts agree, it's bad, and there's hope. And so for each of these, we don't sort of need to launch into, all the evidence that shows that climate change is real or that it's caused by human activity, and experts certainly agree. So today we're going to focus on the it's bad. And next slide, please. If you see like the public, so the Yale program on climate change communication in coordination with the George Mason University program on climate change communication has done extensive surveys, and they show that in fact people already know that climate change is here. 73% of respondents in the US say that climate change is real and it's here, and most agree that it's caused by human activities. There's a growing recognition of the scientific consensus even amongst the public. So climate change isn't as controversial an issue in the US as might appear from the political discourse or from the media coverage. But where we still have some work to do is on this notion of it's bad. And why is it bad? So climate change is certainly an environmental problem, but more and more we're recognizing that it is a problem for those people that are trying to live on this planet. So for all of us, from a human health and well-being point of view, it's bad. And there's clearly some work to do in terms of reaching the public on this point and fully understand the implications for our own health and well-being. Next slide. So here's one of the many illustrations available in government reports and from a number of scholars on the connection between climate change and human health. And it starts with the changing climate leads to a number of changes in environmental stressors, including extreme weather events that we often hear about in the news, heat stress, air quality, water quality, and so forth, and how these interact with a number of factors that predispose some people to be more vulnerable to the impacts of these changes in the environment. And then there's a series of health outcomes ranging from the immediate injuries and deaths associated with specific disasters to less direct pathways. So, taking extreme heat as an example, it's often called the silent killer because you can't really see what's happening and see who's in the pathway and at risk. But as we're going to hear today, there's a number of health effects associated with days of even moderate to extreme heat. So there's a range of health outcomes that we're just starting to understand. And this is really where we want to focus today. Next slide. And it's a great time to be in this field because as recent research shows, the number of Americans that are either alarmed or concerned about climate change is at an all-time high. More than 3/4 of Americans are either alarmed, concerned, or cautious. This means that again, climate change isn't as controversial an issue as might appear from the media. And in fact, all we need to do is keep working at this to move a small proportion of the disengaged and doubtful over to the left, a little bit towards cautious and concerned. So the research that you'll see here today, I think, does a lot of that. It's research to action. And next slide, please. I think the goals for that I hope you all will take away today is one is to recognize the incredible amount of talent that's here at BU in this space. And we're going to focus on that along the themes of think, teach, and do. So research, teaching and training, thought broadly, and translation of that research and knowledge into action. So you're going to hear on all those domains. And really what I hope you'll see is the disciplinary excellence that's being applied on these cross-disciplinary teams to really make a difference in the world, high impact activities. And I hope we'll then take this and either today or in the weeks and months ahead, use that information to build even more collaborations, because together we can definitely make really great progress on reducing the health impacts of climate change. So with that, next slide, please. You see this fantastic lineup of speakers. Again, we have 11 speakers. Thank you so much to each of you for being here and participating, and I can't wait for the discussion. Thank you. With that, let me, so we're gonna, as Dr. Waters mentioned, we're gonna hold questions till the end, but feel free to put them in the chat. And then when we get to the Q&A part, we'll be surfacing those questions again.